So this is a Sonita. She is 17 years old mare. She's quarter horse. In her life, she never had like kind of injury, although she had one cesarean cut with one pregnancy. That is more than 10 years ago. She is very emotional, sensitive, and quite girthy horse, very girthy horse. So definitely there will be some problem. What I can see on her movement, general body stiffness, especially tension in the neck and both of the shoulders. The hind legs looks very stiffed, that it's not going very well. I think that stifle, they are not tracking properly, especially the right one, the right hind, and the left hind is more stiff. It's going like a straight. So I don't know if it was visible enough in this video, but usually when she's working, there is visible that she's contracting abdominals a lot. So especially on the side of the cesarean, on this side, on the left side, where was the cesarean cut. So those are the things I would like to be focused. I would like to check and be focused on. She has a farrier next week, so that. Wanna check the pulse? That's 32 beats per minute. That's fine. Now the breath. Now the breath. I'm gonna be watching her abdominals. That is also okay, 16 per minute. I'm gonna check her gum. She's fine with it. It's pink. Good girl. To capillary refill time is 2 seconds. She's alright with it, so the hydration, she's not dehydrated. She's very tight. It's difficult to grab the skin, but it's immediately back. So she's not dehydrated. I'm gonna check the palpation. I'm gonna palpate if she has some stress points and where are the tight muscles. So I will start here on the head area. Here we have a little reaction. She actually is moving from the pressure. I don't feel stress point, but tension yes. So splenius, rectus capitis, brachiocephalicus definitely. We have here stress point. The rhomboid and trapezius, little reaction. Deltoid and infraspinatus, definitely painful, tensed. Now the pectorals, I think that she has a really big pain there, so I am very gentle. I just see that she really doesn't like me to touch there. So definitely we will be working on that area. Triceps. Triceps, very painful and with a stress point. Also, she has quite developed these muscles here. With the pain here. A little bit tension, but not like a big tension. Actually, I think that it's just the fascia. It is very tight here, but she doesn't have like a pain response. Now, the serratus ventralis very affected. It is almost not touching, like not pushing it at all. So that is very affected area. Yeah, I know that she's sensitive there, so I'm very gentle with her, but there is a lot of tension, yeah, and for sure a lot of stress points, so I cannot get really deep, and that's pretty good. Okay, yeah, stress point, deep pectorals. Yeah, the gluteal, like the hindquarters in general seems to me tight, but she doesn't have so much response. Yeah. Semi-tend stress point, yeah. Now the abdominals, yeah, stress point, external oblique abdominals. Yeah, she's a little bit sensitive, not comfortable there at all. So also the rib attachment, we're gonna stress point. All right, so here, when I found the neck muscles, pectorals, abdominals, and the hindquarter in general, what I would like to work on it. Let's take a look at the other side. Good. Yeah, here are much better reactions. Like it's tight, but not like so much in pain like the other side. Okay, brachiocephalicus also this side, left side, right side. Alright, the shoulder muscles seems less tense than on the other side. Triceps tight, but not such a pain response like on the other side. She's very sensitive, so I'm not going really deep into her. She's pretty clear in her reactions. Pectorals is, we have a tension here as well. Don't eat me. It's just, she's in pain there. Longessimus dorsi, pretty okay. Yeah. I would just prefer like more elasticity there. So we will do some general right there, but nothing like a tension. Yeah. Intercostalis. No reaction. Okay, now the serratus ventralis. Here is also bigger, like this part here is bigger. Yeah, painful. Stress point, pectoralis, deep pectorals. Yeah, very painful. Now the abdominals. Abdominals painful, but not so much as the other side. On the other side it was much clearer. Might be also according to the caesarean cut. Gluteal muscles pretty good. She has here some bite.
Yeah.
Okay, here we have also less tension in the hindquarters than on the other side. Tension in the fasciolata. Adductors fine. Yeah, this side feels a little bit better than the other side, and here I would like to be focused on the brachiocephalic, the shoulder in general, pectorals, abdominals, and yeah, like in general relaxation of the hindquarters, but not as much work as on the other side. Let's do some ROM check, ROM check, range of motion. TMJ feels soft and nice. She doesn't respond. No clicking, no cracking. Feels fine. And we'll also check the other side. Also the muscles are pretty same developed. Also no tension here. No clicking, no cracking. Occipital junction. Here it is a little bit stiffed. She doesn't want to really follow. Also on the other side, so the occipital junction. Not really bad. I didn't felt there any restriction, but she didn't want to really go into it, so yeah, plus. Okay. left side a little bit. Reactive. The right side of the atlas is a little bit reactive. The left side seems to me fine. She doesn't apply here. Also, I have the feeling that the right is a little bit lower. Is it?
What?
From your side? Yeah.
Oh.
Yeah. I think that the right atlas is a little bit painful, and on the other side. Let's take a look at the cervicals. Yeah, definitely painful. C2, C3, C4 fine, C5 also, C6 a little bit painful but not so much. So C2, C3. Let's take a look at C7 and scapula. I will first start with the scapula. She stands quite the same. I will check the sternum. Yeah, you should. Okay, good girl. It's in the center, it's fine.
Come a little bit here, yeah. A little bit here so she won't be in the way.
Let's check the scapula. What you do? Hey.
Balance.
Oh, there is a definitely tension there. It was really very restricted. I didn't want to let her go too further. Come on. Okay, I really didn't like this. A little bit tension. The shoulder is a little bit stiff, but I think that it is only muscle tension. Elbow fine. Knee full range. Footlock fine. Now let's check the C7. I'm not pulling her. I just want to see if she... A little bit restriction. So, but I think that actually that is a little bit according to the scapula. Okay. The withers. And thoracic are fine. Lumbar, more like a muscle tension, not like a reaction for the spine. Sacrum. Sacrum is fine. No problem. And the ribs are in tension. Yeah, but I think that is according to the abdominal pain, that might be also intercostalis painful according to that side that it's affected. So I don't think that there will be some fracture or or subluxation, but I think that mostly the muscle tension in the abdominal area. She's standing quite square. I will check the scapula, and they are in the same position. Yeah, the left scapula is higher and with more atrophy. The right one is like definitely lower, a lot. We might check that for the saddle. Maybe that's why she has the pain, because that's a very big difference. Just one step. Yeah, go. Yeah, a little bit more. Good. But I'm trying to have her a little bit square with the hind legs. Oh yes. Now I can see the pelvis. The pelvis seems to be in the same level. That's fine. Let's see her reaction on. That's perfect. The hip is fine. Oh, stifle, super stiff, almost no range of motion. Okay, might be better, but I don't see it as a problem. The tail. The tail is fine. Okay, I will just quickly do the other side. Never checked it. The atlas on this side. A little bit painful. C4. Okay, C4. Also a little bit better than on the other side. I will not push her, but there's also restriction upward. I'm not gonna push her because she really doesn't like that. C7. I cannot really get there. There is a lot of muscle tension, but she doesn't mind that area so much. Shoulder fine. Elbow fine. Knee full range of motion. Fetlock fine. Definitely there is something going wrong. not putting her, I just want her to put it there by her own, but she doesn't know if she wants to. Yeah, this is what we can. So I'm not gonna push her. There might be some muscle restriction or definitely something going on with the scapula. We're gonna move on. Width are fine. Thoracic vertebrae fine. Lumbar fine. Sacrum fine. Hip. All right. Hip all right. Yeah, the stifle a little bit better on this side than on the other, but still not full range of motion. Hope definitely better on this side. Good girl. Yeah, I know. So what I would like to be focused this session is shoulders, both of them, and muscles around the shoulder, C7, scapula, pectorals for sure, left side abdominal section, and hindquarters in general. We can also work on the muscles around the stifle if we can give them in a more relaxed, and if we can increase the range of motion there. And also the brachiocephalic on both sides, and the left side also splenius, and in general more neck relaxation.